Optometrists and ophthalmologists work together to co-manage their patients, from detecting problems to surgical solutions that best suit the patient's needs. We spoke with Dr. Richard Kidder and Dr. Mark Schlosser of the South County Eye Care Optometric Group to explain their approach to providing eye care.
In the co-management relationship, the optometrist is the first person who starts to evaluate a patient for their suitability or need for a certain surgical procedure. We know the patient's history, we've worked with the patient for years, we understand their lifestyle, their visual needs. We're able to communicate that information to the surgeon, which often has a significant impact on some of the decisions that are made about that patient. Likewise, after surgery, we're involved in the post-operative care, making sure that the patient is healing properly and that the outcomes are what the surgeon had desired.
One of my patients, Patricia, who I've seen for years and years, was interested in LASIK surgery or refractive surgery, and she had been for some time, but she did have some anxiety about it. One of the benefits in terms of us doing that preoperative care for Patricia was that I could assure her that she was, one, a great candidate for the procedure, and two, that I knew the right surgeon to be able to do the procedure accurately and successfully. And then, of course, I got to see Patricia in follow-up care. So I got to see her at the one-day check right after she's had the procedure done and reassure her and that she was healing properly and that the procedure was accurate, right on target.
Well, when I decided to do LASIK surgery, I had to come to my own optometrist, and so I came back to Dr. Kidder and Schlosser's office so they could do the whole pre-op. So I had it done. It was great, no problems. I was most comfortable coming back to Dr. Schlosser and Kidder because they've been wonderful with me. Love them, trust them. So I was actually very comforted coming back to my optometrist.
It's amazing how a team approach, when you work with a surgeon and the optometrist who knows the patient's history and knows the patient's backgrounds and their needs and their wants the best, and their expectations. And when we can blend that together in a marriage and in a team approach to provide for the patients end up on the winning side.
We've had extraordinary technological advances in our industry, and we've been fortunate at South County Eye Care to be able to incorporate some of the latest technology in the diagnosis of eye diseases and other ocular conditions. For example, we've incorporated the OptiMap digital retinal imaging system in our office, which allows us to capture a wide-angle, high-resolution image of a patient's retina, which is the back surface of the eye, without the need to dilate that patient and have them have to wear the sunglasses after the examination. We've also incorporated some of the newest automated examination equipment, which increases the precision and accuracy of our examination and allows us to determine prescriptions to within 1 degree of accuracy, which is far better than previous equipment. One of the more important pieces of technological development that we've incorporated has to do with laser vision correction. We've added a corneal topographer, which takes a three-dimensional map of the cornea and allows us and the corneal surgeon to determine the proper treatment. The most important thing to remember with all of the new technology that we have available and all the new treatment modalities is that we're able to detect problems earlier, to treat them earlier and more effectively. It all means that patients need to come in for an annual eye exam so that we have the opportunity to make sure that their eyes are healthy and that they're seeing their best.